Good day, everyone. Thank you so much for joining us in this next episode in our HIV in View series brought to you by ViiV Healthcare. My name is Raif Darazi, and I will be your host in this very important conversation that we're having today on World AIDS Day. We're going to be covering the topics inclusivity and health equity. And we will dive into exactly what we mean by those terms. And to help me do that, I'm joined by Bruce Richmond, Executive Director and founder of Prevention Access Campaign, as well as Dr. Nneka Nwokolo, who is the Head of Global Patient Affairs. And then we are also joined by HIV advocate, Martha Clara Nakato. To start, let us explore what it exactly means when we say health equity and why do we need it? Dr. Nneka, I'll start with you.
I think health equity for me means ensuring that everyone has a chance to be as healthy as possible. And I think that this is really good. It's good for individuals themselves, but it's also really important for society as a whole. And many of the ills I think that we see in society, and this is across all societies, I think have a basis in or are contributed to by health inequity. And so addressing this is something that is of benefit to everybody.
To me, health equity, just as my colleague mentioned earlier, I would think it's about giving everyone a chance to be healthier as they can, but also something around recognizing the social barriers or even the different economic barriers that limit people to have access to affordable health or even health that they are able to access at all avenues.
Bruce, maybe this is something you can help us clarify. Oftentimes we use the words equity and equality interchangeably, but they're distinctly different. Can you talk about that?
Equality is about giving everyone the same thing. And inequity is about making sure people have what they need to stay healthy. So in terms of when we look at health, equality is around health. This would mean perhaps, making sure someone has access to medication. Which is so important and is really the basis of making sure that people with HIV, like myself, stay healthy and can't pass on HIV. But it's not always just medication that people need in order to stay healthy. There are other aspects, other things. There's mental health support, there's housing, there's food security, there's safety from gender-based violence, there's transportation to clinics, there's all sorts of things that are factors that enable people to stay healthy. And so when we look at equality, ending inequalities or ending inequity, it's really about looking at what do those individuals need? What does that individual mean? It's all really people-centered, human-centered approach to healthcare.
Yeah, that makes me think of the example, like if we give health insurance to everyone, that would be equality. Everyone has health insurance, but not everyone has access to a healthcare facility at the same in the same way. And that would be the equity that we're trying to create for everyone. Is that correct?
Yeah.
That's a great way of putting it. Absolutely.
So I would like to dive in a little deeper as to why it's important that we talk about inclusivity and health equity and what that approach related to specifically the HIV community might look like. Dr. Nneka?
Thank you, Raif. And I think that's a really important question. To me, inclusivity and health equity are inseparable. I think that the two go very much hand in hand. And I think as we think about the sorts of things that we need to do to achieve health equity, I think, first of all, we need to seek and listen to the voices of people we don't see or hear from or who don't register in our everyday lives. Because I think not only are they the ones who are most likely to benefit from, the way the mechanisms to address health inequities, they are also the ones who are most vulnerable. And I'm just thinking about HIV, and I think in a way going back to the first question about why we need health equity. So many people who are living with HIV, I think, they say, not that I think, say that they get treated differently from other people who use health services by healthcare professionals, many of whom see them, for example, as being undeserving of care. I mean, I talk about a patient who comes from a European country who said that in his clinic, they're all sitting in an open waiting room, and the nurse shouts, "All the people who are HIV positive, go over here." And they wouldn't say that to anybody else. And so I think that there is a risk for people who are treated in this way, that they will disengage from care, and in disengaging from care, then their HIV disease progresses and they become unwell, which then is difficult for themselves, for their families, for their employers, and for the health service, and so as a whole for society. And so even within health services, there is inequity that, if it isn't addressed, has huge repercussions on the rest of society.
What barriers are there preventing us from achieving that goal, achieving health equity for people living with HIV? Because once we identify those barriers, then we can do something about it and come up with solutions. Martha, would you like to touch on that?
For me, I think we need to be more intentional on addressing systems and policies, because in a way, like if you're to reflect more around the communities that we work with, or even the health facilities that a number of young people living with HIV go to, you get to realize that bias is conceived and it's learned over time. But of course, there is also always opportunity to unlearn. But are people able, are they more intentional to unlearn? Then that becomes a question. So I think for very, very many healthcare providers, or even avenues where people living with HIV go to, I would want to think that the culture in there is not very supportive for many, especially for public facilities. Because, recognizing that many of these facilities are overwhelmed. You're maybe one service provider, one doctor, and you're handling over 500 clients. And of course, they all have these challenges. You will always get frustrated, or even maybe are looking deeper. Do you have the tools to really address all their problems? So I think it goes back to understanding the structural systems in place, because in a way, these drive stigma and discrimination, but also thinking deeper and looking deeper on the intergenerational gap that exists, the different ideologies that we have, that for a young woman like me, my story may be so different from an adult. So in a way, because of those different ideologies, they always create avenues of how we can exclude each other, or even how we continuously marginalize populations that are most affected by HIV. And then also looking deeper around the different policies. Some of them could be made with good intentions, but still in a way, they do pose a strong barrier.
Dr. Nneka, I'm going to turn to you for this one. What do the results of the HIV perception surveys show, and what do they tell us about what needs to be done to create a more inclusive and equitable environment?
So the HIV perception surveys were a series of surveys done across several different countries, and they really aimed to see whether people's perceptions of HIV actually matched the realities of where HIV is today. And a particular result that I think is really important is about a question that relates to U equals U, which is the fact that a person living with HIV who has an undetectable viral load cannot transmit HIV to their sexual partners. And a fifth of adults globally who were asked whether they knew that a person who is on treatment and taking their treatment as prescribed cannot transmit HIV to their sexual partners were completely unaware of this. And I think that lack of knowledge of this phenomenon, which is in fact is true, it's a fact, it's a scientific fact that you cannot pass on HIV to your sexual partners if you have an undetectable viral load, is a source of huge stigma, I think, for people living with HIV, because their potential sexual partners, as well as just people in the general population, see them as a threat. And the reality is that, people living with HIV are not a threat anyway, but certainly there is no risk of transmission of HIV if a person has an undetectable viral load. So a person with an undetectable viral load can and should anticipate having a relationship even including with an HIV negative partner, should be able to anticipate doing all the things that a person who's not living with HIV should do with regard to their sexual lives. And it's really, really important that everybody understands this.
And Bruce, a lot of the work you do in U equals U actually helps to combat stigma in many ways. Can you talk about that a little bit?
Sure. So with U equals U, it's really an unprecedented opportunity to dismantle HIV stigma, because now we know when people living with HIV are on treatment and have an undetectable viral load, which means that the virus in our body is reduced so low by medications that it's not detectable by tests, then we not only stay healthy, we can't pass on HIV through sex. So that's really a revolution in what it means to live and love with HIV. And this is changing people's perceptions of HIV. It's still a serious condition. It's still something that we want to prevent others from acquiring, but it's also a manageable condition, and we can't pass on HIV as long as we have access to effective medications and care. So the whole concept of what it means to be a person with HIV is changing, and that's really reducing internal and external stigma. We're seeing people that are now, actually more people are getting tested because they are, the fear and anxiety around HIV is being reduced. We're seeing more people coming into care or staying on treatment and staying engaged in their care because they're feeling better about themselves and about their medication and about their opportunities for a life with love and sex and babies like we never thought we would have. So that's what we do with U equals U. Is one of the things we're doing is impacting stigma, internal and external stigma.
So I'm starting to see a little bit of a path forward here coalesce, because if we're reducing stigma through things like U equals U, people are more educated and open, then that leads to inclusion. Once we have more inclusion, then we have the openness towards changing policies and procedures to have more health equity. Seems like stigma is at the root of a lot of that. So why are campaigns like HIV and ViiV so important? Why is what we're doing today, getting together and talking about this, why is this important in breaking down stigma and improving inclusivity?
Oh yeah, Rafe, I was just going to mention about your program. Connecting to community is so important, especially now when we've been so isolated, and it's such a dark time in so many parts of the world. But being able to connect with people who are experiencing something similar, or just to show support to each other, is so important. We really have to talk about HIV because, as Martha said earlier, many people don't know how much HIV has changed, and that there are tools that we have to prevent HIV now, like PrEP for people who are HIV negative, and we have treatment now. People can live long and healthy lives who have HIV, and we don't have to worry about passing on HIV to anyone. We can have sex, we can have intimacy, we can conceive children without any fear.
I agree, it is difficult to talk about U equals U in an intimate relationship, potentially with a partner who's negative. But I think that if everyone is talking about it, and if everybody understands it, and if these are things that people are talking about in general conversation, then it becomes easier in an intimate relationship. And that's why it's so important to have these conversations, both as we all are now, but just in wider society as well.
Yeah, Nneka, I think that's so important. It really is, and as Martha, as you said earlier, it can be really scary to have that conversation with someone about U equals U. I remember even the first few years of this campaign, when I was dating and I would talk to people about U equals U, and I'd show them the research on my phone, and I felt like I had to give someone a science lesson before sex, the science, and to prove somehow that I wasn't dangerous to them. It's a really hard thing to do, and it can be scary, and I didn't feel like I really had the tools to even be able to have those conversations. And I think, as Nneka, as you're saying, that we make sure that U equals U is common knowledge, and really promote this, the easier it'll be for those of us with HIV to have those conversations.
Well said, everyone. I know that we could continue this conversation, and like all these episodes, we could just keep going because we've barely scratched the surface. But like I always say, the point of our conversation is to get the conversation started. So you folks at home can continue these conversations with your friends, loved ones, community members, and healthcare professionals. Thank you all three so much for joining me, for taking the time. You all have so much insight and experience. And for those of you at home who are watching who do feel alone, please know that there are so many people like the folks here on this chat today around the world, scientists, researchers, advocates, community members, entire villages of people working for you, with you. We love you. So thank you so much all for tuning in to this episode on inclusivity and health equity. Thank you to ViiV Healthcare for continuing this critical series, HIV in View. My name is Raif Darazi. It has been a pleasure to be your host, and we will see you next time.